Prior to 2006, I was a visiting artist in the Cancer Center. At that time, there were many artists and writers working with the children to create their original visual art and creative writings. But all the musical activities were performance-based, where the children were the listeners, but not the creators. And I felt that a one-on-one musical experience was the missing element. So I was inspired to create a program where the children could write and record their own songs. Purple Songs Can Fly was created to give the children being treated in the Cancer Center a unique musical experience. Our recording studio is housed in the Cancer Center's outpatient clinic, where the children come for their appointments, checkups, and chemotherapy. We've also created a portable studio so that we can work at bedside with the inpatient children. Our goal is to fully utilize both our recording studio and portable studio 5 days a week, and to add additional portable studios to increase our outreach. In order to do this, we need a larger team of experienced songwriters, musicians, and support staff who are committed to serving the children and families. We're housed in the largest pediatric cancer center in the United States, which fully supports the idea that writing and recording a song can be of great benefit to a child's well-being as they battle a life-threatening illness. As more and more is learned about the connections between creativity and health, music and the mind, self-expression and a healthy immune system, we're in a unique position to facilitate life-enhancing experiences while simultaneously creating the best possible model for the nation's pediatric healthcare community. Ultimately, the success of Purple Songs Can Fly has been the inspiring, fun, thoughtful, moving, joyful, hopeful songs that have come from the children. Purple Songs Can Fly is effective because we bring the simple joy of writing and recording an original song to an unusual setting, a pediatric cancer floor. Here, songs become messages to the world. Children have written songs of thanks for the people in their lives who've been with them throughout their illnesses. They've also written songs about life and death, the side effects of chemo, their families, best friends, and even the many faces of God. Because a song can access feelings that can't be expressed in any other way, Purple Songs Can Fly provides a different kind of medicine. Our primary metric of success is the number of pediatric cancer patients whose lives are positively affected each year through the writing and recording of their original songs. The number of children who've written songs has increased each year because we've gradually added additional songwriters as well as greater recording capabilities through our portable studio. Our success is measured by the joy and smiles we see each day as a child writes and records an original song. Because we're housed in the Cancer Center at Texas Children's Hospital and partner with their Arts in Medicine program, it's commonly assumed that we're funded by the hospital and the Cancer Center. Purple Songs Can Fly is a separate nonprofit organization funded largely through individual donations and grants. We're an artist-based program, not a music therapy program. While writing and recording a song may indeed be therapeutic, the goal of Purple Songs Can Fly is to give each child a positive creative experience. All of our songwriters are gifted musicians, but are not music therapists. Hundreds of original songs have been written and recorded. They've flown on 2 space shuttle missions and summited Mount Everest. We've inspired the creation of several similar programs around the world. We've been featured in many national publications and broadcasts, including the New York Times and NBC Nightly News. Olivia Newton-John created a song with us and performed with our children on a national television special. 5 of our children wrote a song and performed it at Carnegie Hall with full orchestra and children's choir. We produce a monthly online radio show with Voice America Kids, hosted by two of our children, which reaches 10,000 listeners. Many people want to see Purple Songs Can Fly grow to serve other hospitals and populations. Our goal at Purple Songs is first to create a sustainable program that fully serves the children at Texas Children's Hospital. When that goal has been achieved, we'd like to publicize and share our program and operating model with other hospitals around the country. Our biggest challenge is securing a reliable, repeatable revenue stream to sustain a program that can fully compensate our songwriting staff. Additional resources would allow us to increase the work hours of our songwriting staff from part-time to full-time and compensate them at a greater level. We'd purchase additional portable studios and hire staff to more fully serve the outpatient and inpatient populations at Texas Children's Cancer and Hematology Centers. We'd collaborate with other hospitals in the Texas Medical Center to initiate research studies to scientifically document the physical benefits of creating original music. We'd like to expand our organization so that we may serve the pediatric cancer patients of Texas Children's sister hospitals and affiliates around the world. We're often asked by other hospitals how to establish similar songwriting programs. In response, we'd like to create a documentary that captures our organization and the process of writing songs in a children's hospital. We'd like to add a research component to Purple Songs Can Fly to fully document the benefits of songwriting in a pediatric setting.